Hello, everyone. Thank you for joining us for today's webinar. My name is Myra Chen, and I'm your host and moderator for today's eLotus webinar. Here at eLotus, we have been hosting educational courses for over 3 decades, and we are proud to be your trusted source for premium CEU content with over 200 speakers, 700 courses, and 3,000 hours of CE. Today's webinar is Clinical Success for Scleroderma, Epilepsy, Post-Concussion Treatment with 40 plus years of herbal mastery with Dr. Jimmy Chang, sponsored by Evergreen Herbs. Dr. Chang has over 40 years of concentrated clinical experience treating over 500,000 patients, specializing in differential diagnosis and herbal prescription. Today's sponsor, Evergreen Herbs, is the perfect partner for Dr. Chang, as he has strictly purchased herbs directly from them for the past 30 years. His pharmacy has over 150 single herbs and formulas combined. If you're interested in starting a pharmacy just like Dr. Chang, you can order Dr. Chang's Evergreen Herbs webinar special and receive 15% off on the herbs he currently uses in his clinic. This special includes formulas such as his famous astringent complex, herbal ABX, and various classic formulas and single herbs. I'll send a link in the chat room for you to check out. This class will be presented in a similar fashion as his previous classes, so I will explain Dr. Chang's webinar for our new students joining us today. Dr. Chang's formulas will be listed in the Fang Jia Fang style, meaning formula plus formula. In addition, he will write a percentage after a formula to indicate its ratio in the prescription. Dr. Chang typically prescribes his patients 100-gram bottles or 150-gram bottles if they are not local or if the disease is chronic. Dr. Jimmy Chang, a widely known figure in the TCM community, has been instructing at eLotus for the last 2 decades, contributing to a substantial array of courses on our platform. For those interested in more pulse diagnosis, we suggest also enrolling in Dr. Chang's comprehensive Pulse Synergy 1, 2, and 3 course series for foundational pulse diagnosis knowledge. For our new attendees joining us, let me familiarize you with our webinar room. Please set your chat from host and panelists to everyone so that everyone can be part of the conversation. To ask questions during the webinar, please use the Q&A box so that the questions remain separate from the chat room. And lastly, the quiz. The quiz for CUs will be available by the next business day late afternoon for everyone with qualifying attendance. Now, let's get started with today's webinar and welcome Dr. Jimmy Chang.
Hi, can you hear me now? Okay, great. Okay. Hi, guys. This is me again, Jimmy Chen. Today is the July 21st. We're going to do something about the post-concussion epilepsy scleroderma. Let's take this one off. Yes. Today we're going to share with my experience of treating all this and all these very interesting problems and some basic concepts of dealing with anything. That's my approaches you might want to know. Very interesting. Help you a lot, I'm sure. So let's do it. Now, this is how I do things. You can tell what the patient's constitutional condition is like from the appearances. And then you can make your own that's the decision to do the corresponding prescriptions, because we don't do treatment by the Western diagnosis. We don't do that. Hey, doctor, my family doctor give me a diagnosis that I have something. We do not follow their sayings. We do our own system to know the body type and the condition of the disease. Then we make our own approaches. That's very, very important, because sometimes I have a new theory. I told my students that we have 2 different approaches. First one is heart attack. It's not the heart, it's ARD, very strong attack. Secondly is the soft approach. What does it mean? I'll tell you right away. It's my new invention. You can say the new invention. I have a new concept of dealing with things just simply by watching their body type. The body type. Oh, okay, you got this one. See, the body types, and of course, pulse diagnosis and blood pressure. Blood pressure can give you a very strong and clear indication of what kind of herbs you should use for this kind of patient, and it give you better results. Trust me, it works very well. Today, this afternoon, I was seeing patients early this morning. A young lady came here for her third visit or something. She had a problem with the skin, all the redness in the skin. And I checked, oh, my file, my prescription was 人参养荣汤, 加味逍遥散, just 2 of this. Why? I'm not using any traditional formulas for skin problem like 消风散, 白虎汤, whatever. I was using 人参养荣汤 and the 加味逍遥散 because I think she's very nervous, so that produced a lot of a liver fire. Liver fire, oh, sometimes just equal to skin allergies. And 人参养荣汤, 养营, 荣营 is the same thing in Chinese. That means blood. She is very anemic, blood deficiency. So I did not choose any kind of skin formulas I used to use. I just give her something for her blood and for her mood. And of course, liver is related. Then she got much better. All the itches, everything better. So that's what I call a soft approach. But for a big, strong guy, usually I just give him everything I can think of. But anyway, let's do this in the beginning. In other words, decide your treatment approaches by the body type. It's very, very important. Huh? Okay, let's watch some interesting video. Before Chinese medicine, she was so painful. Now start taking Chinese medicine, feeling better, and finally happy again. And this guy with a severe painful headaches, of course, he said, can't bear anymore. Start getting better and happy again. We Chinese medicine sure can do that. Okay, this is what I said. When a patient comes into your office and sits in front of you, all you need to take a look at this. Hey, oh, I can't. This looks like a normal guy, right? And this is skinny and tired. Her blood pressure must be low. Heartbeat rate must be low. And this one is even lower. This is the case I talked about earlier, just a few minutes ago, about the lady with the skin problems. I didn't give her anything for skin. I just tonify her blood with 人参养营汤. 营 means blood. And 加味逍遥散. A skinny lady like this tends to be very, tense and nervous and frustrated or something, and help her a lot. And okay, look at this. This is a big, strong guy. In this case, usually I do not hold anything back. I just give him everything I can get, like 血府足浴汤, all those hard attack approaches. Oh, for elderly people like this one, skinny and pale, something, we use the same thing, almost the same thing. But if a guy looks like this, pale and skinny, looks like he's young deficiency. But if his blood pressure is very high, then you got to be very careful. That could be the kidney type of blood pressure or kidney failure or something. So be careful. Judging from the appearances, you have to know his blood pressure. Is it really low as it should be, or is very extremely high? That can be, we call the hidden blood pressure. If you follow me enough, you know what I'm talking about. You should check this area to feel the big artery there. See if it's big and strong or weak. So no matter what, you should have their blood pressure taken with the lady in your office, and then before he sits in front of you, right? But from outside, he looks very tired. And so is this guy, but it's not too bad. And opposite to this guy is this condition. To this, see, she's kind of a chappy, and what kind of type they might be in? Damn heat and cholesterol and blood stagnation, all the circulation in the blood. And majorly, they have a lot of water edema water retention in their body. So the treatment for the same sickness name, for example, they all have this concussion or something, but the treatment will be totally different. It's common sense, so easy to understand. And this one is a hard-working man. He should be strong, but not necessarily. Huh? Wow, look at this big muscle guy. He must be very strong, right? Actually, it's not. Pause, following all those observations of their body types. Huh? So be careful before you give anything to them. We don't. It doesn't move. What's wrong? Supposed to be. Oh, yeah. The keyboard jam. Okay. Again, the treatment methods for different body constitutions are absolutely not the same. A guy like this, a guy like this, even they both were diagnosed with the same problems, concussion or skin problem or epilepsy or anything, treatment will not be the same. That's very simple, right? And look at this normal guy, big, strong guy, skinny girl, elderly people, we have different combination. That's why we're here studying all those things to get a better treatment result. If the guy like this come for me for no matter what, oh, have a back pain, of course he will have back pain, neck pain, joint pain, no energy, a lot of emotional anxiety. He might have anxiety too, but the treatment will be totally different. What I'm trying to tell you that you can use those blood movers almost freely for this kind of body type. But for this or this, you cannot. So be careful. Huh? Interesting, isn't it? Come on, what's going on? Oh, here. People with different physics have completely different treatment. It seems that many people, TCM, now Chinese medicine treatment is not based on the terminology of Western medicine. That's very, very important. I have a line group, that's 500 people in there, the maximum capacity. They always ask me, hey, doctor, do you have a special formula for something? Hey, doctor, you have a special formula for eczema, for smoke cut, or for insomnia? I always tell them different body type or different treatment. We have our own rules. Some of them are like this. Yeah. And let's follow this. Qi deficiency, the blood pressure must be very low. Yang deficiency, and then this is neutral. Phlegm, dampness, yin deficiency, the heartbeat rate is high, blood pressure is low. Qi deficiency, damn heat with a lot of fire. I always tell this kind of people, hey, you have a lot of your body's like a volcano, too much inflammation, blood stasis, intrinsic, the others reasons. So before you decide to do what kind of a treatment, you have to know all their body conditions. And this, we'll be talking about this today. This is the Bagua. Okay. The Bagua pulse. This first one we'll be talking about here. It's head and colon. So this is the head and colon. So the pulse, okay, let's do this. Majorly, it's the right foot. When you touch it, you try to feel the superficial area, and you press down a little bit and more down a little bit. If all three levels are strong, something like this, then you can directly tell there's something wrong with his head. I always tell him, hey, you got something in your head. And you can also tell by the fingertips. Some of the fingertips are swollen up and red. That's funny. And the rest of the finger are pale and white. Only the tip are red. So I can directly tell, hey, you have something in your head. So no matter eyes, ear problem, nose problem, even the teeth, even the mouth, it's all in the head. So the pulse will be like this. So this indicating a solid solid heat. So you must use something like a 白虎汤 or something stronger to with it. Huh? Okay, now today we'll be talking about scleroderma. We're talking about 3 categories: epilepsy and post-concussion, system sclerosis. All the skin swollen. Actually, like I said, this area, the fingertips are swollen. See, something like this. That means the head. So he must have some kind of a discomfort in the head. Could be the eyes, could be the ear, could be the nose, or the tinnitus, headaches, dizziness, sleeping disorder, disorientated, and everything. But anyway, you can directly tell something wrong with your head. And you can easily verify it from the ear point, like this. But anyway, let's talk about the scleroderma. The focus on the syndrome differentiate, addressing whatever, skin sclerosis, vascular lesion, internal fibrosis, and autoimmune dysfunction. Depends on what kind of a body type it might have. For this lady, obviously she's anemic and tired. So when this lady sits in front of you with this kind of a problem, what's the first formula that comes to your mind? What's the major formula you would use for pale, weak, elderly lady for that? Even the condition is swollen, see? And all the dead circulation. We must use something to tonify her energy, like a soft attack. I will use 四逆汤 and 四全大补, something like that. Oh, last time previous weeks we talked about thromboangiitis obliterans, the Berger's disease, something like this. I really have seen some of those conditions. I just couldn't remember this name, but whatever, I know what to do. At least you must use 四逆汤, correct? For the peripheral circulation. And for this condition, it's not too bad. Yeah. See the redness? That's the head. If anybody with the fingertips like this, but no, this is the serious scleroderma, that means something in the head. See, the color in the head and the body are not even. So it's more swollen and red. Okay, in this case, this area is the breast for lady. This is the liver for sugar. And if there's some kind of blue lines here, that's the cholesterol. And this is the back injury, something like that. Okay, let's do the first one. The first case, qi. Qi, stagnation with blood stasis, because stuck. Skin hardening, the whitening, shining because swollen. Cold extremities, and something like this. The qi, this is left-hand side, is deep and weak. Like we always mention that when you start taking the pulse, you should imagine there are 3 springs under each finger, and you should try to feel the rebound of those springs. So in this case, the third one is collapse, no more rebound. So that's the weakness. By looking at this is the chest actually. And the groove is means heart ischemia. See all the darkness? That's the head. This is the colon. His colon is terrible. This is the hip. He must have some old injury. This is the arthritis. And this is the bulging disc. And this is the chest. And it's the neck and shoulder is twisted. And majorly it's the head. Now see the dots in there? Darkness, that means blockage in his head. And this is the key point. This neck and shoulder is twisted, so it stopped the blood flow. This should be some gap between these two edge. And there's no, it's still so close. So it stopped. This area is like a bottleneck. Stop the do-my flow to the head. So he must have a lot of discomfort, dizziness or headaches, or depends on the other condition, the blood pressure or something like that.